Greetings. Let us talk about high-level disinfection of an endoscope. These are my acknowledgements. And today's learning objectives include two things. One, we will learn the purpose of high-level disinfection of an endoscope and how to perform high-level disinfection, at least the principles of high-level disinfection. So before we come to high-level disinfection, the endoscope has to go through a series of steps in the procedure room, pre-cleaning, and once the endoscope is brought into the scope cleaning room, a leak test, followed by manual cleaning and visual inspection for any damages. And if there are no damages, then it can go to high-level disinfection. Following that, drying and storage. This process destroys vegetative microorganisms, mycobacteria, fungi, and viruses. In terms of high-level disinfection, a number of different solutions can be used, and each lab will have its own preference. These include glutaraldehyde, rapicide, peracetic acid derivatives, hydrogen peroxide, etc. A couple of concepts to keep in mind. One, before you open the container, make sure you look at the shelf life of that container. If the container shows that the shelf life has expired, then that disinfectant solution is going to be of no use. So make sure you check the shelf life before you open the bottle and use that disinfectant. Once you've opened it, and then you may have to use it again, and in that case, make sure you check the use life. So when you open, you need to put in your date and signature, and then looking at the use life, the disinfectant solution should be used before a particular amount of time, otherwise it will be ineffective. So these are two important principles: shelf life and use life. So once these solutions are used in the automated endoscope reprocessor, otherwise known as AER, or high-level disinfection unit. So you take the scope and place it inside the machine, and then it's important to connect with an adapter that can connect the different outlets and the channels to the scope, and those connections should be secure. It's also important to keep the endoscope loosely coiled, not tightly coiled. And it's important to make sure the connections from the AER, that is the high-level disinfection unit, to the endoscope, those adapters, one should make sure you use the proper adapter for a particular scope. You cannot mix and match. A EGD scope will have a particular set of adapters. Colonoscope will have a different set of adapters. So make sure you pick the right adapter for that particular scope. And then make sure they're all connected properly and securely. A loose connection may not work. If you're putting an ERCP scope or a therapeutic EUS scope, Make sure you keep the elevator at 45 degrees so that the fluid, the disinfectant fluid, will clean out the underside of that elevator. So once the endoscope is securely connected with the adapter, loosely coiled, you close the lid and then you start the machine. And depending upon the manufacturer's instructions for use, that's what you should follow. You decide the particular program that the machine has to go through. At this point, I would like to talk about an important concept called contact time. The amount of time the high-level disinfection solution will be in contact with the endoscope, both inside the channels and outside the scope, completely contacting the entire scope. That contact time will be defined by the manufacturer and the facility using the disinfection process, and one should make sure that you should not cut short the amount of contact time required for high-level disinfection. Once the machine starts, it will ask you to check the solution because the disinfectant solution can be used for multiple cycles, and it is important to make sure that the disinfectant solution has the minimum recommended or effective concentration. And how do you go about doing that? You collect the solution depending upon whether the scope is on the right side or the left side of the machine from that particular bin, and use a test strip and dip it in the solution that you collected from the bin and check whether it is a pass or a fail. If it is a pass, then the cycle can go on. The cycle of disinfection can go on. If it were to be a fail, then you should completely fill up with a new batch of disinfectant solution and restart the process. The machine will give you a lot of data, and it will also tell you when the disinfection cycle is complete. On the left side, you can see it is completed, disinfected, and after that it will also tell you when to open the lid and take the endoscope out. On the other hand, if there is a failure in the machine, it will give you an error message, and it will ask you to do certain things to fix the problem and go back and restart the cycle from A to Z. There are no shortcuts in high-level disinfection. You should let the machine do its job. Once this cycle of high-level disinfection has completed, you take the endoscope out and make sure you use a lint-free cloth to dry it out, and then attach a tag, and that tag is very important. It will talk about the date of processing, the person who did the processing, the date of high-level disinfection, and the expiration date. In this unit, they prefer to put the scopes through again disinfection process if it has not been used for 14 days. So with this tag, you put it in the container and then you take it to the next step, that is scope drying. So in this video, we talked about the principles of high-level disinfection and the different solutions that can be used, and it's important to keep in mind shelf life, use life, contact time, and also it's important to keep in mind that when you place the endoscope in the reprocessing unit. It should be loosely coiled. If there is an elevator, it should be at 45 degrees. And the correct connecting tubes or adapters should be used. Make sure you're using the specific adapter for that specific scope and follow the manufacturer's instructions for use. Always check the disinfectant concentration, whether it's effective or not. And if it failed, repeat the process by refilling the tank. And do not cut short the cycle. Follow the steps. Thank you.